Hi, I'm Dr. Barbie Allegretti. I'm a chiropractic physician here at Supreme Wellness and specialize in functional medicine.
What inspired you to become a chiropractic physician?
Before I went back to school, I worked with my husband as a gym, as did Steve back in the day. And I wanted to get more into holistic care, recovery, actually more like therapeutic exercise. That was a big part of my life then. And so I started back into school in my mid-20s, and it was during chiropractic school that I learned I could practice more internal medicine when it came to care, but that piece interested me a lot more.
And how did you transition into functional medicine?
So during school, many people might not know this, but in Illinois, chiropractic physicians are primary care physicians. It is our scope of practice to diagnose and treat conditions, and chiropractors naturally are focused on finding the root cause of something and more of a holistic, comprehensive care for patients, including lifestyle, nutrition, sleep, exercise, movement. We just practice differently. And so during school, I went through a course on functional nutrition and immunology, and that just opened up the door for so many other areas of study for me that I wanted to pursue that were in addition to the physical medicine of chiropractic.
How do you personalize treatment plans based on lab results that you get?
I'm crazy in this area. I would say I'm a psycho about it, but I don't want to scare people because I am very, very specific when I analyze labs. You can run labs through programs. You can still get great outcomes and recommendations from that. But I love sitting down with patients in the beginning, getting to know them, going through their current concerns, their struggles and challenges, and then I decide from that, and we decide, it's not just me, we decide working together what direction we want to go, and then order the testing. And so I'm not just looking at the objectives from the lab results. I'm taking into consideration all of the things that we've discussed from their current and past medical history, and I'm aligning that with the findings from the labs. Also, what their preferences are, their likes, their dislikes, what their day-to-day habits are. Are they cooking for multiple people? What do they have access to? I go through all of those things with them to really help them find an approach that's manageable.
And how does being a mom to 3 girls influence your perspective on women's health specifically?
All my girls were born at home. I did home births for all of them. On my youngest daughter, who is almost a year old, my girls were there for the birth. So we're very, very open. They know the capacity of our bodies. They know how they work. If they don't, they'll ask. But there's a lot of daily reminders too that I work with them on. But they're kids too. They yell at, get mad that I don't want them to have pop or, red dye or things like that also. But
And what's your favorite way to spend time with your daughters?
just kind of, being around the house. We love to be outside, just playing in the yard, basketball. My oldest plays softball, so a lot of times we'll play softball or wiffle ball in the front yard. But we're outside a lot. And do each other's hair. They like to do makeup, go shopping.
What is your favorite family tradition that you have with your family?
We have a lot. We go on vacation to Wisconsin to a lake every summer and just have the best time there. So that's a tradition. Just have a lot of, daily rituals that I think are tradition. We eat family dinners pretty regularly. I'd say usually 5 days a week we sit down, all of us, and have dinner. The So there's a lot of daily things that we do.
What's the most rewarding part of working with your patients long term?
Just getting to see them change and grow over time. A lot of times, so I've been in practice just over 12 years. I have kept relationships with so many of my patients over the years, even if I've moved on to different practices. But working with patients long term, a lot of times they get to the point after usually within the first year, unless there's something that's pretty complex and chronic going on, within the first year they get to a point where things are pretty steady, stable, and from there we're really just monitoring if there's any change over time, but the goal is just maintaining that. So we are able to reconnect. It might not be as often as we used to in the beginning.
What's one lab marker you wish everyone would test annually?
Can I do two?
Yes, of course.
So two tests that are not typically run but are very easy to get are that I think, and the reason I chose these is because it can be life-saving. So it's simple markers and it can be life-saving and life-changing. Is looking at a advanced lipid panel. So I use a panel called Cardio IQ. So that looks at cholesterol, standard total cholesterol, triglycerides, HDL, LDL. But then you look at a breakdown of that, which is called the lipid fractions. It looks at small, medium LDL particles, large HDL particles. It looks at the pattern and size. And we want a certain distribution of those particles. So, and then within that same panel, so I'm squeezing like 12 different tests into these two, but that's all one panel. Within that panel is a marker called lipoprotein little a. That's a genetic marker, so it runs in families, and that increases risk of stroke. So having that baseline or knowing if that's present, so a lot of times for patients, if I ran this in the parent, then they might see for the kid, or maybe I ran it for an adult, and they're like, hey, actually my mom had this. I realized my mom had this marker, so they can find that correlation and support. And then the other one, because the thing is, if you run those tests, even if it's a struggle with lifestyle, there are some targeted nutrient therapies that you can use that I have seen bring down those levels significantly within a short period of time, even 3 months. So that's one, is the advanced lipid panel, the Cardio IQ. The other is homocysteine. And homocysteine is a marker that, when really high, can play in with cardiac inflammation. So another one we don't want a lot of. Anything heart related, I don't primarily practice like with cardiovascular disease, but I'm screening it on everybody. And anything heart related, if it's that controllable and modifiable, even just with simple interventions from a supplement standpoint, I want to know. So that other one is the homocysteine, and that is also very, very easy to bring down, but you wouldn't know to bring it down unless it's tested.
How do you incorporate nutrition into your protocols?
So I kind of start with a baseline. Tell patients, I see where patients are at. So if they already have an established way of eating and routine and maybe belief around how they're eating, I help guide them where they're struggling with that, or if there's anything they're doing that is negatively impacting their current health, and then certainly refining that once we have specific markers to go off of. I will do food testing occasionally for patients if they want it, or if we feel they need it. That helps refine that as well, but that is just a temporary intervention. It's not a long-term intervention. My typical approach is we're omnivores, but the spectrum of what people might include when it comes to animal foods might vary more or less depending on their preferences and needs. But some patients will come that are vegetarian or vegan, and while that might not be my first line recommendation, if that's where they've been for a long time, then let's at least work up labs and see how we can optimize that if there's certain nutrients that aren't being met. And then I help guide them through that with the treatment plans.
What's your favorite form of self-care?
I love to read. If I'm not reading, I might be listening to an audiobook. I love to learn, so I'm always referencing different books when it comes to health or medicine, and I love to cook too.
What's your idea of a perfect day off of work?
Good weather, if that's within my control. Time outside with the family, maybe barbecuing some, grilling some steaks, having friends over, just spending time outside playing with the kids, which, we get to do a lot of, so I guess I have a lot of perfect days.
What's your go-to coffee order?
I'm a tea girl, although I have been drinking a bit more coffee with the baby, but usually I'll get tea, like an iced black tea or iced green tea.
For a night out, what's your beverage of choice?
I don't know if this is boring or just predictable, but I usually just get like a sparkling, maybe a Prosecco or champagne.
How do you help patients stay consistent with long-term wellness?
That's a good question, because I tell them I help them to navigate what their needs are, but they get to do the work. So I can't do it for them. The number one thing to start is knowing what they need to do. So that's why I love the testing rather than, that test don't guess phrase. So when you test and you know what's going on, it gives purpose to then what the plan is. If you don't know and there's no shortage of information on what could be wrong with you, what other people are telling you possibilities are, or that you see online, it can be really hard to navigate that and to put it into a manageable plan. So I think that's the first thing, is having a purpose to it, and then following and tracking that. So a lot of times, like, we start off with what do we believe is going to be the most effective and efficient treatment plan for this. When we implement that, then I follow up with patients within a few weeks, make sure things are going okay, or ask them, reach out to me if there's any issues. And then in 6 weeks, we follow up to gauge, okay, what are you seeing? Anything better, worse, the same? Do we need to shift gears on any of these recommendations or the way we're approaching it? If everything is going smoothly, we stay the course, and then at the 12-week mark, we retest the abnormals. So we want to see over that period of time the improvement of symptoms and some progress and momentum that way. But then also when we retest at 3 months, the abnormals, we want to see improvement in those values as well.
And how do you support hormonal health through functional medicine?
Oh, it's like the missing link for hormonal health, because hormones there's so much more to hormones than just the hormones themselves. They're so intricate, just like any other area in the body. Everything is interconnected, but they're very intricate in how they're influenced by different body systems. So, and women are very different from men. So the things that might influence that for a woman is going to be different for a man. But like I said, it's not just about hormones, but we could talk thyroid. You want do all the thyroid tests. I might support somebody for thyroid with a normal TSH, normal free T4, normal free T3 even, but maybe there's some other, their total T3 or total T4 is on the low side. You want to give that a little bit of a bump. But again, not just looking at the hormones themselves, you want to think of all the things that influence that hormone function. That could be stress, that could be sleep, that could be nutrient deficiencies, that could be inflammation, that could be toxicity or infections. So I think going beyond just looking at the hormones themselves and that box, and considering the influence that all of these other things have on hormones when you're working that up. So that's kind of I think, beyond the conventional approach. Maybe it's gut, maybe it's detoxification. I tell people with hormones, you want to make them, you want to use them, and then you want to clear them out. So the problem might be with one of those areas. Maybe they're not getting cleared out well, but you're making them fine. But on testing, if that's what's the only thing that's being evaluated, then and that's being tested and it looks normal, then all is well. But maybe they're not being used properly and they're not being cleared out well.
And I know we talked a little bit about different ways you teach your daughters about health and wellness, but being a woman yourself and then having 3 daughters of your own, how has that changed your personal perspective on how important it is to focus on women's health?
I think it's difficult to watch people struggle with infertility. These great people who would be great parents, and so I think that's a piece of it too, for sure. And supporting people, that's also kind of, when it comes to women's health, like a missing link, similar to hormones. There's this gap in the middle between baseline testing and then infertility or fertility treatment with things like IUI or IVF, which I support a lot of patients in that as well. But there's this gap in the middle that isn't really assessed and supported. It doesn't have to be one or the other, like very simple or very complex, but there's this in between that isn't evaluated and treated in a broad sense. So like I mentioned with those hormones, supporting gut health, supporting toxicity, nutrient deficiencies, stress, but not just stress in and of itself, looking at like the actual circadian rhythm, like what do the actual markers look like, and then getting objective info on stress. Maybe it's nutrient related. So I think that's probably a big piece with women's health, is the fertility. And then that's just on one end. On the other end of like the reproductive years is perimenopause and menopause. That's also an area that has a huge gap. So and then everything in between, even just PMS, PMDD, like the answer for a lot of, or the treatment options for a lot of people is like, okay, well, you can go on the pill, or whether that's PMS or PCOS or perimenopause, it's like that's the answer for everything maybe. And there's so many other options. So I think, across the board, female health concerns or challenges, there's just a big gap in support there. And it's one thing when it's delivered to them as far as like, okay, this is just the only option we have, but sometimes it's delivered in a way that is kind of demeaning to the patient, and they're left questioning themselves, and that's not okay either.
How do you and your husband stay connected with busy work lives and being parents?
We're like yin and yang in so many ways, that we complement each other. I think my strengths aren't his strengths, and his strengths aren't mine. So, and then a lot of times, like, just, when things are really tough, like we're so supportive of each other. at the end of the day, just partners and supportive and have the same values and goals and just want to help people and have a good life.
What advice do you have for someone curious about functional medicine and are hesitant to go get their blood tested?
Oh, so this happens in a couple of different ways with patients. So maybe they're curious about functional medicine, but they're hesitant about blood work. I would say there's usually 2 reasons for hesitation around blood work. One is like they're a little bit nervous about the draw itself, the quantity of vials, so the actual process of that happening. The other one is, and that I'd say you can work yourself through that. That's more of a temporary physical thing. The other one is with anticipation of what the results might show. So, and that can keep people from actually going through with it. And I'd say I do not get into fear mongering around whatever the results might be. There's an answer or support for. So, even if they thought through, well, what if it shows this or what if it shows that, then okay, then you take the next step of supporting that finding and getting more information around that. And then there's more relief in going through the process. But I think for me, I don't get worried or stressed around that for a patient because I know that we will exhaust all of our options, which there's a lot. I don't even know if we could get through them all of our options for supporting it. And if we got through all of that, then there's so many colleagues and mentors of mine that I refer to as well. But those are probably the 2 hesitations that people have, and everyone's always so happy that they overcame that.
For sure. Well, thank you so much for all of your answers. They were incredible, and we will see you soon.
All right. Thank you.